Good afternoon, everyone. I'm Zack Kucharski. I'm the executive editor of the Gazette in Cedar Rapids, and we are here for the conclusion of our Iowa Ideas in Depth Week, focused on health and human services, with our topic looking at children's mental health. The topic that we're looking at today is mental health in schools, and joining me are Brad Niebling from the Iowa Department of Education and Allison Bron from the University of Iowa. We are going to kick things off in a couple minutes. Before we begin, I wanted to quickly say that you can ask questions and we will work them into the conversation. And you can do that using the Q&A button that's at the bottom of your screen by clicking on that and then typing in your question. That will get to us and we'll be able to work that into the question set. Without further ado, I think this concludes the week. I want to say a special note of thanks to Tanager Place, who's been a sponsor of In-Depth Week. We're continuing to build programming towards the conference that we do each year in October. Registration, it's free to attend. It's a virtual conference, and about that can be found on iowaideas.com. And without further ado, I think we'll jump right into the questions. I think this is a topic that could probably be discussed for half a day. And we only have an hour. And so I wanted to ask each of the panelists to introduce themselves. And Brad, I'll start with you.
Sure. Thanks a lot, Zach, and to everybody. Really appreciate this opportunity to talk about a really important topic. My name's Brad Niebling. I'm a bureau chief at the Department of Education here in Iowa. And so of my responsibilities, one of them is to provide administrative leadership for our work around social, emotional, and behavioral health and well-being. I'm a school psychologist by training, so I bring that to the table. So in that capacity, we've got several projects and initiatives, and hopefully we'll be able to talk about some of that here today, including the partnership with the Iowa Center for School Mental Health, which has been a valuable and really important new partnership that we have. I am also the director of the Department of Education's designee to be the co-chair of the Iowa Children's Behavioral Health System Board. So that's another aspect of the work I do in this space.
Excellent. Thank you, Brad. Allison.
Great. Yeah, it's wonderful to be here. My name is Allison Bron. I am a professor of special education at the University of Iowa. I've been doing that for the last 11 years. My work has primarily been in school-based interventions and assessments for kids or at risk for emotional and behavioral disorders. My sort of love for this topic started when I was a middle school science teacher. I had a lot of kids with challenging behavior in my class, also a lot of kids who had been exposed to pretty traumatic home lives. And those were the kids that just really tugged at my heartstrings and kind of led me into this profession. And so now I am the executive director for the new Iowa Center for School Mental Health, which is a partnership with the University of Iowa and the State Department of Education. So Brad and I work quite a bit together.
All right. Well, I look forward to the conversation that we're going to have. And I think kind of the orientation piece, Brad, maybe start with you. Talk a little bit about what the Children's Behavioral Health System State Board has been up to. This is something that was put in place in 2019, I believe. And, each of the pieces kind of take a while to get going. And hey, there's been a pandemic in between. But I'm kind of curious, what has the board been up to, and kind of what is the current state of the state system today?
Sure, absolutely. So the Children's Behavioral Health System Board has got responsibility to provide some oversight, but also recommendations and guidance related to the children's behavioral health system itself, which is a collection of disability regions across the state that have got oversight, funding, and then ensure that there are mental health services for our children and our students here in the state. The current version of the board is actually evolved from prior committees that had been commissioned by the legislature, recognizing the importance in the increasing need to meet the social, emotional, behavioral health needs of both adults and kids. And so that board and the system was actually put into law, as you noted, Zach, around 2019. And so that board started with a strategic plan that was really focused on legislation, recommended legislation. And so that's what helped establish the actual children's behavioral health system itself, and using the regional system that the adult mental health system had. It utilizes that same region. So that board was influential in getting some recent legislation passed and supporting that work. Since then, the board has been working hard on bringing awareness to mental health needs in our state, working towards establishing a system of metrics and outcomes that they could review data on how things are going in the system, so that they could ultimately fulfill their other charge, which is to provide recommendations to the Department of Human Services and also the Department of Education for how we could then pass policies, have resources and tools for our communities and for our schools and mental health. So they've been really focused on that data system and providing recommendations over the last couple of years.
And I'm kind of curious, what do you see as kind of the strengths and the challenges of the children's mental health system that's in place? Obviously, this has kind of been a deep dive inventory and opportunity to pull things together in new ways.
Sure, absolutely. Strengths, many, in my opinion. It's been very heartwarming and encouraging to see how many dedicated and passionate professionals that we have around mental health across our states, and most of those constituencies are represented on this board. And so there's a lot of strength in that passion and that skill set that we have out there. I would also say that we've been in a policy environment that's been very supportive of mental health, and particularly as it relates to mental health services in the schools. So, and I see several legislators on our call here today, and the legislature has been very supportive in passing recent policies around required training for suicide prevention and postvention for educators is one example. So we've got a policy environment that's very supportive in shining a light on mental health needs in our state. I would also say that the investments of relief dollars spearheaded by the governor and the Department of Education's director, Ann Lebo, and the dean of the College of Education at the University of Iowa, Dan Clay, of getting some of the relief money that we got because of the pandemic and helping that be seed money for the Iowa Center for School Mental Health. And so now we've got this dedicated center for that work that we didn't have before. And I know the university is working towards that. And I think that this additional financial investment is really helping accelerate the good work of the center. And I think that's a real asset to our state.
Well, Allison, I'll kind of jump in and kind of talk a little bit about with the COVID relief money. I think $20 million was earmarked to get the center going. Can you talk a little bit about, in the early days, what you're working to do?
Sure. So it feels like it's still the early days, but the reality is we started this work last summer, so we're almost a year into it. So we've spent a lot of time building processes and procedures and hiring people at the same time that we've been doing a lot of work. So we have 3 different arms of the center for pre-K through 12, and those include a professional development arm. We have put out a ton of professional development opportunities for educators, including school psychologists, counselors, behavior specialists, you name it. And those have been online offerings. We've also done a lot of in-person training and coaching for schools. And we're currently working on developing some online modules that educators will be able to complete sort of on their own and earn free continuing ed credits. We have hosted, in conjunction with the State Department, a huge conference last fall called the Iowa Best Summit, the Behavioral, Equitable, Social, Emotional, and Trauma-Informed Health in School Summit. And we are going to be doing that again this year. Last year, we had over 1,600 attendees. So that was super exciting, and we're really looking forward to doing that again in the fall. We also have a research arm of our center, and so we've been engaged in some research projects around social emotional learning and counseling programs in schools, mental health awareness training, as well as some technology-based supports that we're piloting in a couple of different school districts. We are also, our third arm is clinical services. So we will be opening an on-site clinic at the University of Iowa in the fall of 2022. And that clinic will be able to provide some short-term intervention services, some consultation and referral, but people will also be able to access that via technology through some telehealth services, because our charge is to serve the entire state. And obviously everybody's not coming to Iowa City for services. So we've been doing a lot. That's kind of the short list, but it's been a really exciting time. Oh, one more thing actually I'd like to add is that we also have done a lot of crisis response. So there have been some pretty substantial things that have happened in our state around crises at schools. And so our team has been deployed to be at the schools and provide on-site services around individual and group counseling and some additional, professional development supports for educators and for students.
I guess I'd also take that opening question to you too, is as you look at the children's mental health system today, what are you seeing as the strengths? What have you been hearing as maybe opportunities as you're starting to build those connections and do the work?
Well, I would echo what Brad said around the dedicated professionals in this state. There are many. And I think, when we have meetings with the mental health regions, the AEAs, we hear the same thing. Everybody wants what's best for kids, right? How we go about doing that might vary across the board, but I think it's nice that people are open to collaboration and, working together to solve some of these issues. I think, with the state investment in our center, it's a huge opportunity to make a difference and to fill gaps where there might be some. And so a lot of what we've done over the last year is to dig in and find out where are those gaps and where we can make a difference and add value for the state.
Maybe dive a little bit deeper in there. Where are you seeing those gaps? Obviously, you have to work quite a few layers. There are the AEAs. You've got the, I would guess some of the urban centers that have more services available. Where are you seeing kind of your space?
Right. So, I mean, it's interesting. Like I can give an example of one of the first things that we have done around crisis response was in what happened at Fairfield. So many of you guys are probably familiar with the murder of a teacher. And we were immediately in communication with their superintendent and with the AEAs. And initially we thought, there were probably enough people from the AEA to provide services. But as other things were happening in communities nearby and the problem seemed to grow a little bit and people were just really traumatized by that event, they needed additional support. And so the AEAs talked to us, the superintendents talked to us and said, hey, can you come out here and just be a support for us? So we had our crisis response team go out. They set up meetings with individual grade levels, with teachers, and then they were out there every Friday for several months and continued that type of service from November through May, actually. And so, and they offered telehealth supports over the breaks, so Thanksgiving break and winter break. And so that's one of the things that I think is really difficult is that when there is a crisis, immediate response can happen fairly quickly and easily, but it's the long-term piece that is more difficult and sometimes harder to recognize because, people's responses to that, whether it's anxiety or sadness or depression or fear, may not sort of manifest until later down the road when something triggers things.
I was going to ask, Brad, you mentioned a policy environment that has been receptive to this issue. Do you think that COVID and some of these very serious incidents have kind of helped shine a light that work needs to happen here? Or what do you think that favorable environment is coming from?
Yeah, I do. I do think that the pandemic has contributed to again, just really shine the light on some of the needs that are out there. And I will note that some of the legislation that's been passed here in our state predates the pandemic even. So I think there's been a recognition in our state, and I think that comes in part from legislators. I think it comes from the governor and her office, and I think it's come from several other sources like this, like the board as well. That it's there's a growing recognition. The pandemic did increase that recognition, the need for policies and resources to support mental health. And what we're talking about here today is focus on kids in schools as well. So yeah, I do think the pandemic contributed to that, but there's been a recognition in our state that work has been needed, and the policies are now creating more opportunities for us to pursue that work.
I was curious, one of the projects that was noted in some of the board minutes, and there was a grant opportunity that several districts took advantage of for therapeutic classrooms. And
Yes.
I'm curious if you could talk a little bit about those, and how are those being designed? What is the kind of the intent behind that? Who uses the classrooms, and is this kind of a bridge to additional, a pilot of some sort to see these extend into other districts?
Sure, absolutely. So a couple of years ago, there was legislation that came through that really in some ways started before the pandemic and has kind of carried through, where there was money budgeted towards requirements for what are known as therapeutic classrooms. And so therapeutic classrooms are classrooms that are staffed by people that have got additional training and resources around mental health for students, and an environment that is smaller than a typical classroom in a typical school setting. And so it's an opportunity for students to receive additional, more intensive, more personalized services around mental health, in addition to the more traditionally education-focused services kids would get in an environment that's temporary. Right? These are intended to be therapeutic, to make advances, and then to get kids transitioned back to their home schools or their home classrooms. But it's a safer environment for everybody, for some of these kids to be in for their learning and to receive a lot of the mental health services that they need. So as I noted, that in that legislation, which was actually focused on classroom clears and effective classroom management strategies and professional development for educators, there were a whole host of things that were in that legislation. But as it relates to therapeutic classrooms, funding was set aside for that, and so districts had to apply to hopefully help either start new therapeutic classrooms or to help build up therapeutic classrooms that they already had going. And so we end up awarding those dollars to 6 different districts. I believe it ended up being 15 total classrooms in that case, for startup money to do that. So those classrooms had things like, in terms of how they were designed, we've got a specific set of criteria that was written to, that include things like the program had to be supported by a multidisciplinary team, because we know students that have got significant mental health needs, we're going to need a lot of coordination between different folks. And so that was part of what needed to be in place. They needed to have a plan for how they were going to develop things called individualized behavior intervention plans. They're based on functional behavior assessments, or FBAs and BIPs, because we got to have nice acronyms for all the things that we do, right? So FBAs and BIPs, they had to have a plan for how they were going to implement those, grounded in trauma-informed practices. So, and how they would generalize and transition kids from into these classrooms and then back out. So just some examples of how these programs are designed. They needed to demonstrate that they had features like those in place. And those that had the strongest proposals were the ones that were awarded the funds. So this year has been largely a startup and a growth year then for these programs. And there's also some around their transportation costs. associated with this too. So there's money set aside for that as well. So we're really just the end of the first year of all of this and collecting data now to see how it all went.
I was going to mention or kind of ask about some of the data. I think that's one of the other pieces the board has been trying to put in place is some of the metrics and the analytics and starting to measure things. And I'm kind of curious if you could take us through some of the discussion that the board has had about the metrics and the analytics, and is that helping? Allison, I'll throw the question to you then to kind of figure out, hey, how do we start to build some of those processes and those connection points and measure effectiveness? Brad, I'll start with you though.
Sure, absolutely. This has been a long-standing conversation with the board that actually predated the current version of the board. There's been a few iterations of this board with the different legislation, things that have passed over time. But this has been a long-standing conversation. And so the board's made up of a broad cross-section of stakeholders, different state agencies, Tanager Place, for example, who's sponsoring this wonderful event that we're a part of right now. And so there was a committee of folks from the original board that had expertise not only in mental health and delivery of services, but also in how do you build an evaluation system? How do you measure these things? How do you quantify it? And so they identified an initial set of really important outcomes, and which was approved by the board. They took committee back to the whole, and the whole decided and approved. And then as that moved forward, we established a new committee to start identifying what are the metrics or important questions that we then ask about these outcomes that we want to measure, and where did the data sources live? We at one point had 22 different metrics that we wanted to measure, and we've discovered over time those data live in at least 24 different data systems across different state agencies. And so as you can imagine, trying to pull a system together like that, it takes some time. And I think the encouraging part here is the board's expected to do it. They're allocating their time and resources to getting that work done, and really expecting our agencies then, especially the Department of Human Services and the Department of Education, to start pulling some of these data together so the board can look at them and then decide, is that helping us answer the question, or do we really mean something else? And so we're really, and again, the pandemic kind of set us on a different trajectory with some of that work, but as we're getting settled back in with it more, the board is reprioritizing the things that they want us focusing on. And so we're just in that new iteration of that, reprioritizing and continuing to just, again, get our hands on those data so we can set baseline on on the things that are important to them.
Well, and Allison, I think earlier in the week, I think a lot of those data points that are starting to be collected are, you have cascading types of things that you're collecting from teachers and from students. I'm curious, how important is that measuring to be able to set direction as you're working to get the program off the ground?
I think it's hugely important. I think Brad and I, this is one place where we really agree on data. We're both sort of data nerds. And so anytime that we can use data to make decisions and promote equitable implementation of different, services and hopefully promote positive outcomes, that's a plus. And so we've been in contact, obviously, with the State Department about, the different data that they collect, for example, conditions for learning survey, and what do we learn about how students feel about their school. One thing that's been consistent is, lower scores around emotional safety in the school. And so what does that look like in terms of our center? How do we provide programming that might address that issue? So, for example, might we provide programming on things like PBIS, which is designed to create safe, supportive, positive school environments? How do we train educators, both pre-service and in-service, to help their teachers facilitate a sense of belonging for their students and how to develop relationships? So data that we might get from a survey can inform that. Another piece of data that we have been looking at recently, we've done sort of needs assessments at different school districts and how their teachers, their parents, their students, their administrators view social, emotional, behavioral type programming and instruction, and how they view the role of the counselor. And so that we've used that as a way to kind of develop plans for districts to say, okay, this is what your constituents are telling you. Here's how you can potentially make some improvements. Another piece of data that I think we would like to collect at some point would be around universal screening. So we do a lot of universal screening for academic skills in schools, much less so for social, emotional, behavioral needs. That is not a common practice across the country, but it is a recommended practice across the country. And so to do that, however, also requires that schools have systems in place that can address the needs when they're identified. So it's not just about the identification piece, it's also about how do we use that data to then get kids into the targeted or intensive supports that they need. So a lot of moving parts, but yes, back to the data. Again, if we can use data to make decisions, I think that's the direction we have to go.
I'm curious if you've started to see common themes in some of those responses, or kind of as you're building the needs assessments for schools, are there things that are starting to kind of come up repeatedly? And then I'll jump into the assessment question as a follow as well.
Yeah, I think one thing that comes across is that educators need support. When we look at our teachers, for example, we would consider them first line responders in dealing with social, emotional, behavioral needs, but they're trained to be teachers. They're trained to instruct. They may or may not have courses on classroom management, but they're not trained to be counselors. And so we have to kind of figure out, like, what are the things that teachers can do and should be expected to do, but what are also the things that they can refer their student to a counselor, to a psychologist, or the social worker in the school, and helping those systems work together so that it's not all on the teachers, because we know that that also contributes to burnout and attrition from the field. So that's another piece of data that we've seen is across the board. Actually, we're working on the data analysis of a national survey on from teachers and the extent to which they've thought about leaving the field over the past year. And the data are not great. So that's a bit alarming.
And you mentioned the screening and the or the kind of the universal assessment is like to, and I'm curious, I mean, do you see that becoming a piece that the center will be working to kind of put that infrastructure in place with schools as you grow?
Absolutely. So that is something that we are exploring right now. Myself and Gerta Bardoshi, our director for research and training, have a lot of experience with universal screening, both as teachers and school counselors and as researchers. And so we're aware of different methods and ways to do this, different screening options, but we're also exploring some technology around this issue, because one of the things that you find in schools with this is that it becomes sort of a scalability and sustainability issue. Even when a school agrees to do that, when things are paper-based and it requires them to score and then spend hours, sifting through the data, it's not efficient, it's not sustainable. And so we're looking really at both efficient and effective ways to do that, and potentially through technology.
And I was also curious, you mentioned kind of, the referrals and other pieces refer to a counselor and other supports. And I'm curious, what do you see as the capacity for the system? Earlier in the week, I think it was in the Wednesday program, we had someone say, well, once they get a diagnosis, there's still an 18-month wait to then get services. And that's been that way for a decade since we started the facility. I'm curious, what are you seeing in terms of capacity in the system? And what concerns, or if you start to see all of this data, how do you expand that capacity?
I mean, it's a big problem. There is no doubt. The federal government back in the fall put out a document of, I think, 7 recommendations for addressing social emotional behavioral needs in schools. And one of them is to increase workforce capacity. There is definitely a labor shortage around mental health providers and, providers within schools. So we know that the national rate of counselors or students to counselors is 424 to 1. In Iowa, we're a little bit lower than that, but it's still not great. And so, at least from the center's perspective, having a clinic available is one thing. But again, we're charged with serving the entire state and going to, do that through telehealth services. But the other thing that we've tried to do is to leverage sort of the visibility of the center and the financial resources that we have to recruit people into the profession. And so that would include counseling psychologists, school psychologists, social workers, and school counselors, and provide them opportunities within the center to get kind of some specialized training with people that are doing this work.
I'm curious, you mentioned that you were just compiling the results from a national survey about the teachers who have considered leaving the classroom. Is there any, in terms of the service providers and counselors, are there similar concerns there, or how, what does the pipeline look like coming out of COVID?
I have not seen any specific data on that. My work has been, at least in that area, focused on teachers. But I know that Girta, our director for research and training, has studied burnout and attrition among school counselors for quite a while. And so I would refer you to her for that. I know she was a panelist earlier.
She was.
This week. But, given the workload and the increased need as well as the low number or the poor ratios, I would imagine that we will see similar things. I wouldn't be surprised.
I'm curious if some of the data that, you're starting to see, is COVID been a major disruptor? And is that period over? Or is that something that, as we continue to have, major incidents across the country, school shooting in Uvalde and these other incidents, does that prolong some of the trauma and some of the mental health concerns that maybe we don't even have a full scope of, where we are at present in terms of trauma?
Yeah, I mean, we're starting to see, and Brad, jump in here anytime, just in data or peer-reviewed studies that have come out looking at the impact of COVID, and it seems to parallel some of the findings that happened after Hurricane Katrina, where these issues are exacerbated for students who had some risk prior to Katrina and prior to COVID, and that those effects can be lingering and potentially long lasting. So you couple COVID with, some of the other societal things that have been going on, it makes for a difficult environment. And so, I guess one of the things that I think about in the support that we give is, how do we manage what we can do in combination with what's going on societally and in culture and what's on social media and what our kids are seeing all the time? I think that schools are in a really difficult position, particularly around social media and technology, and having to manage this.
I was also curious, obviously COVID was a major disruptor in some of the education trend data, but absenteeism was something that got talked about a lot, achievement loss. And I'm curious, Brad, maybe what you're seeing as you examine some of that. Are those trends changing after the school year that's just completed in most areas of the state, or what are you seeing there?
Yeah, it's been a really interesting time to try to collect and analyze data that are really critical, right? Because we had the school year where the last 3 months, disappeared. And then we had another school year that had a lot of online learning, starts and stops, school closings. There were changes in the data reporting requirements in this time. And then we had the following school year that's just been wrapping up where some of the more the data collection requirements are getting back into place. And so um, we're always mindful not to overinterpret any data that we have at any one point in time, especially when it's hard to make some apples to apples comparisons when the conditions change, right? And so it's been difficult to analyze some of the data. But what I would say is twofold. One is Allison was just laying out some of the national data that is available to us, historical research on traumatic experiences like Hurricane Katrina. We know that events like what's been going on are disruptors and they can be very traumatic for those involved. As that's playing out in the data, we're just now starting to dig into more because we've got more available. We have seen for some of the early literacy data that are required to be collected in our state, we absolutely saw a noticeable drop off in performance across the state, right? And that's starting to tick back up again as the school year is more typical this year than the year before. But that certainly had an impact. Looking at the attendance data has been particularly challenging to manage because some of the just what attendance meant was different over the course of the last 3 years. But our preliminary examination of what's out there now and what we've got at our disposal is that we're continuing to see a lag in attendance compared to where it was pre-pandemic. And I think what's going to shake out over time is that it's going to be a pretty significant lag of getting kids back attending regularly. Chronic absenteeism has a pretty high bar, but it's a high bar because we know that even minimal disruptions in attendance, for whatever reason, be they excused and reasonable or not excused and not reasonable, when you're not engaged in your learning, you're not engaged in your learning. And so that's why it's a high bar. And I think what we're going to see is chronic absenteeism is a huge issue in our state that's going to require very intentional work on all of our parts to try to improve.
I know that there's the youth risk behavior and the Iowa Youth Survey. Those were also disrupted during COVID, and I'm curious. Is that something that as a result of that disruption that maybe the way some of that data is gathered is going to change, and also are there signs of what you're seeing in some of those survey data that are concerning, as things get back on track?
Yeah. So the Iowa Youth Survey, for example, is one that's required in state law to be administered, and there's some particular parameters around that. And we partner with the Iowa Department of Public Health in promoting it and supporting their use of those data as well. So we're partners with them in that, and they've been taking a long, hard look at how do we administer these surveys and still meet what's in the law, but how do we do that? Because I think it's been tough because it's not required to take. It's required to be offered to be administered. So there are some real challenges there. And I think it's important to recognize in that is a lot of the challenges are because of the challenges educators and schools are facing in doing their day-to-day work. So it's tough to do extra data collections and things like that. So it's a tough environment. So I know they're in those conversations, and we've been in some of those with public health to see if they can get their response rates up to where they need to be. What I'll note though too is one of the pieces that's been in the Iowa Youth Survey historically that we've actually been able to call out at the Department of Education because of the Every Student Succeeds Act, which doesn't sound like it should be part of the mental health conversation, but actually is here. There's the Conditions for Learning survey that Allison was referring to earlier, which are items that have been in the Iowa Youth Survey, but are very focused on school climate and culture. And so that's actually required for every school that serves grades 3 through 11. Every school is required to administer that survey. And so we've actually got a huge data set, because that's part of an actual requirement that schools have to do, that gives us insights that we haven't had before on school climate and culture and how supported kids feel. As Allison noted, the one that really jumps out as concerning is a vast majority of our students are reporting that they do not feel emotionally safe at school. And that's not a criticism of schools, but rather, I think, a reflection of where we're at collectively right now and what our kids need. And I think that's all the more reason why it's important that we have conversations like the one we're having today. And we've got partnerships like the Center for School Mental Health and the departments, the Iowa's Children's Behavioral Health System. These are all critical pieces, and having data like the conditions for learning data helps us hear the voice of those that we're trying to serve in ways that we haven't been able to before. And so that then makes it incumbent upon all of us to be shoulder to shoulder with not just our districts and schools, but our area education agencies, our AEAs, that have got so many talented staff who focus on social, emotional, behavioral health, that we're partnering with them too as they serve districts and schools to figure out what we can do with climate and culture to meet kids where they're at with their emotional safety needs.
Mm-hmm. Kind of continuing on that emotional safety question, obviously, if you're asking that question at school, there are lots of things that can happen outside of school, and it's also schools where kids spend the majority of their time. I'm curious, when you see something start to jump out like that, Allison, how do you dive deeper at some of that cause? Is that something that the center is doing now to kind of look at, okay, emotional safety, why, or what are maybe some of those causes that students are saying they don't feel safe?
Yeah, it's funny you should say that, because I was just writing down an idea for a research question around that data, because I would be curious to see the fidelity of PBIS implementation at Tier 1 and the emotional safety that students feel. So in a PBIS school that's doing it well, they have clear, consistent routines, procedures, expectation. They acknowledge, positive behaviors. They build positive relationships. They use data to make decisions. And so that would be one thing that I would look at. And then also, just beyond sort of that, are there systems in place in those schools that facilitate students to feel emotionally safe? Or is it constantly that we are just reacting and responding to issues? Do we have any sort of preventative supports in place? What kind of relationships are educators and adults in the building with students?
Do you have a sense of maybe where that is current state? And I would imagine it's different, but I would also guess that staffing ratios and just the time that students have with teachers to build those connections, or if you have a class of 30, maybe it's more difficult to get attention. And do you have a sense of where we are?
I think one of the hard things is, we're talking about building relationships, but that educators also have needs as well. And so they, I think, have been put through the ringer over the last couple of years, just with COVID, because not only, dealing with what's going on in their families and, having to manage that, teachers have kids who were at home or in hybrid situations, or, family members who were sick. So having to care for their own needs while also caring for a room of 30 students. And, with what was happening around attendance, kids in and out of school, like that's really hard to manage as a teacher, and keeping up with where everybody is. And so I think not only do we have to consider how kids are feeling, but also the impact that everything has had on educators, because those two things are going to go hand in hand. If educators are not feeling well, that's physically, emotionally, financially, spiritually, all of the factors of wellness, that can also have an impact in the classroom. And so that's one of the things that our center has been looking at, is how do we support educator wellness so that educators are well, so that they can also take care of their kids.
Well, I would imagine that that's, if you had 1,600 participants involved in, training, last year for a center that's, I would certainly think that
Brand new.
brand new, you've landed in a space where there's clearly a need and clearly a willingness.
Right. There's absolutely one of our directors of higher ed programming and mental health always says there's bottomless need but finite resources, and that's just 100% true. So actually, at our upcoming summit in the fall, we have a whole strand dedicated to educator wellness. So it's not that just that we're recognizing how do teachers support students, how do we support teachers and counselors and school psychs.
And I was curious, just maybe as we're looking ahead out into the future, how do you see the center evolving? Is that a major focus, or are there other strategic pieces that you think, based on what you're seeing in the schools now, need to be focal points?
I mean, I think it's always going to evolve. I mean, we're obviously brand new, but we have to be responsive to what we're seeing in our communities and across the state and then nationally, and policies change, and, things happen in society that impact. I mean, we couldn't predict a pandemic, and here we are, right, responding to it. So I think that's always going to evolve. But I will say that, when we started, we were initially pretty focused on students, and it became clear right away that our educators needed a lot of support. So that has kind of shifted our focus a little bit, maybe earlier than we thought it would, but in a very positive way. So we're actually offering a ton of workshops this summer for educators around sort of these wellness topics.
And what has the appetite been? Are they full?
Yes. Hugely. Yeah. I mean, we've like almost every single one of them is full. We did an 8-part webinar series this year through our PD arm. And I mean, we were having 300 to 400 attendees per session. So people have been very receptive and are hungry for this type of information.
Okay. And Brad, I'm curious, as you see the Children's Health Board, how do you see that work evolving? Or are there kind of focal points that as you're starting to get some of these data, the metrics, coming in, where do you see the board focusing next?
Sure. So the board actually just finished a strategic planning sort of cycle where we're revisiting what we've been doing and where we want to go. And as we got more refined about getting into the data and the metrics, getting that where it needs to be so they can make the recommendations they need to. What I can tell you is thematically anyway, from the chair I get to sit in with the board, what I'm hearing a lot of in the strategic planning conversation, but then also just as we're meeting together and working together is concerns about workforce shortage, both in sheer number, but also in geographical location. And those kind of go hand in hand. But we've got vast swaths of our state where if a family needed to get mental health services for their child, they may have to drive a couple hours at least just to get there, right? And so you talked about, Zack, earlier, waiting lists for services. We don't have the workforce in numbers that we need. The folks that we have, outstanding. We just don't have enough of them. And so I think that's a huge issue. And how that translates out and ripples out then is when we don't have the service providers that we need, then we lack the services that we need. And so as a result, what happens is a lot of times kids end up, when they're in crisis in particular, is that it becomes a law enforcement issue, and law enforcement is trying to provide mental health care or get kids to a place. And a lot of times they're going to emergency rooms, which oftentimes are not equipped for any type of long-term care related to a mental health crisis. And so these are the things that weigh heavily on our board members, is just that scenario right there. which and we always have discussions around what's billable, what funding is available for services too. That's always going to be part of the conversation. So we certainly hear that, but I think workforce and trying to drive that up, and what can the board do to recommend and support increasing our workforce? How can that be incentivized? And we're fortunate because Iowa Workforce Development has a seat on the board. And so the director of Iowa Workforce Development is there and is part of those conversations. So I think that's a huge part of what the board's been talking about. They also really recognize, and Allison was talking about this earlier, the interplay between having good assessment data, like good universal screening data, being attendant to the sensitivities around collecting those type of data, which is probably another issue for another day. But even if those data are collected, our schools or our communities prepared to provide the services that are needed. And so there's this real push for, we need better data, we need more data out there so we can identify kids that may need more help, but we don't always have the services in place. And so I think the board is, I think by and large, really looking and problem solving and discussing what recommendations can we put in place that could lead to effective policies and resource allocation. Because the issues I'm laying out are not unique to Iowa. I mean, these are things that happen across the country, and there's not going to be a quick fix for any of it. And so it's going to be a collection of policies, resources, and people really coming together to continue to build the children's system out and to get services to where they need to be. So this is the roundabout conversation that happens whenever we get together.
Well, and obviously there's telehealth, but that's only one tool. Are there other, ideas that are starting to take shape at the board at this point, or is it? I would imagine that the urban-rural divide is something that is a real challenge. And if you have to go a few hours for services, access to care, what's realistic?
Yeah, and I will say there's been recent legislation in Iowa too that has allowed telehealth delivered in school settings to be a billable service, right? So that was a wonderful policy advancement, and there are some details around universal screening in that too that were a real advancement. So those are things that help move the conversation down the road and help with some of it. Telehealth is it's got to be appropriately matched to the circumstances and the child's needs. So sometimes that's really going to fit the bill, and that helps us increase our reach. At other times, it may not be the inappropriate match, right? And so it's as you noted, Zach, it's one of the tools, and we've got more latitude now for some of that, which is great. But I think we're still at the drawing board to figure out how we incentivize more people to go into the profession. I think a lot of this really does come down to getting more people to provide the services that we need. And so I know some other efforts that we're supporting with workforce development are registered apprenticeships, which include registered apprenticeships for school counseling, right, and school counselors. So there's not going to be one big solution to any of this. It's going to be a collection of policies and people coming together to get more folks going into the profession and then positioned where we need them to be to provide the services that are needed. We need more folks.
Well, and Allison, to that point, are there efforts that the center is trying to do? Obviously, you sit at an academic center that folks learning and getting into the field, but maybe from a training standpoint to get them into the field sooner, or are there efforts that you're looking at along those lines?
So that's one of the things that we're doing with our clinic that's opening in the fall, is that it will also serve as a practicum and internship training site for people in counseling, psychology, in social work, as well as school counseling and school psychology, because all of those majors have to go out and they have to do practicum, they have to do internships. And previously, I think in counseling psych, I might be wrong on this, so forgive me if I misspeak, that there wasn't a site for them to be in the state. And so this serves as a potential way to keep them in the state so they can do internship and then maybe they'll stay. And so that's really what we're hoping, is that our clinic will also be a great site to get specialized training and then potentially keep people in the state of Iowa. Because a lot of times, people leave to go and do some, whatever, their internship or residency or whatever it is, and then they don't come back, right? So how can we keep them here and provide them with the tools and the strategies, the education, the experiences that they need? So that's one great thing about being at the University of Iowa, is that we can do that.
And I guess as we wind down time, if you look ahead to the next year, if there were two changes that you could make in the children's mental health system, one or two, I guess you don't have to pick two, but I don't know that you'd be able to pick one. What would they be? And what would you like to see, to continue the trajectory that we've been working on at the state? And Allison, I'll start with you.
Oh, shoot.
Okay, well, I can
start with Brad. Okay, well, I'm going to stay in my lane, which is in schools. So
Okay.
if I think about this school-based systems, I think that there are several things. One is that we have to move away from this reactive, responsive, or constantly responding to issues, and be more preventative in nature. And we have 25 years of research on multi-tiered systems of support, positive behavior interventions and supports that offer a systems approach to creating safe, positive, consistent school environments. And so I think those have to be in place. Teachers, counselors, administrators in particular have to prioritize this for kids, because the reality is, if students are feeling anxious, sad, scared, depressed, it doesn't matter what math book you put in front of them or how engaging the lesson is, they're not going to engage. And as Brad talked about, they might not even attend. So, we have to recognize that social and emotional behavioral needs go hand in hand with academic needs. And that doesn't mean that our teachers have to be counselors. They're not trained to be that, right? But there are things that they can do. They can build relationships. They can create positive classrooms, safe classrooms, and the systems and the administrators and the districts that support them can provide the resources and the strategies in order to help the kids who need more when they're identified by a classroom teacher. And so I just really passionate about taking that systems-based preventative approach.
Yeah, and I would say too, echoing 100% agree with what Allison's saying there about multi-tiered systems of support. And we're fortunate that Allison and the graduate students that she works with over time, we've got nationally recognized experts in PBIS right here in Iowa and in the center. So we're really fortunate to have that. And the Department of Education is fully invested in PBIS. So that the last thing I would say is, if I were to change one thing or to keep things going in a direction, is to continue the cross-sector collaboration around meeting kids' needs. So we've got higher ed, we've got school systems, we've got community-based providers, different state agencies. We need the business community. We need cross-sector collaborations that continues to elevate the importance of mental health as equally important as physical health, academic success, financial success, you name it. Mental health has got to be elevated to that same level. I think that that's where we're headed. And having these cross-sector collaborations is what we need to make sure it stays as important as it needs to be, and that we fund it and source it and work towards those outcomes that we want for all of our kids.
All right. Well, I think that we've reached the end of our hour together. And so Allison and Brad, I appreciate you taking time with me today, and to our audience for participating, and those who watch on the rewatch. And so on behalf of the Gazette, as well as our Iowa Ideas team, wish you a a great Friday afternoon here, and look forward to continuing to engage in other topics as we head throughout the year. On behalf of the team, thank you, Brad. Thank you, Allison.
Thank you so much. This is great.